we do know for a certainty is that 2017 plans are still there, and people are signing up for a contract with a private insurance company. That contract is going to be binding. So we are actually seeing a peak, a spike in enrollment since the election because people are anxious to get their plans to make sure they have coverage and peace of mind starting in the new year.
And it's also interesting that we have heard some speculation out of Washington from the president-elect himself that it might not be quite as cut and dried as we were led to believe during the campaign.
Well, that's exactly right. I think anytime you take political rhetoric and turn it into actual policy, you're going to see some shifts in what people are talking about. But here's what we know. Consumers are really eager to keep the coverage that they've put into place. The ACA plans that people sign up for are quality. They cover what people need in terms of their health care. And so we've seen it really make a difference in a lot of people's lives. If I can just describe one person who's really been impacted by it, there's Kim Jones, who lives in Wake Forest. She's a person who had not been able to afford coverage for some years prior to the Affordable Care Act's marketplace opening. And she signed up with the help of a Navigator in 2014 and got her coverage. And she went to see a doctor and found out she had a brain tumor. She had to have brain surgery and then recovered and returned back to work. She actually has more recently had a heart attack and had open heart surgery, all the same while she had been renewing her ACA plans. So she's currently in recovery from that. But if she was sitting here with me today, she would be the first to tell you that her Affordable Care Act health insurance plan saved her life.
Coming back full circle to what happens in this political environment, what do you think it would mean to these people if the Affordable Care Act wasn't here?
Well, it's hard to imagine taking this opportunity away from people at this point. We are seeing people whose lives are being changed by access to this coverage. I mean, I hear stories, it's not every single day, but it's not uncommon to hear stories of people who've been able to get this health care that they weren't able to access without the benefit of coverage. We know that in this world, having a health insurance card is oftentimes the keys to a doctor's office. And so if you take away that health insurance card, I worry a lot about whether people are going to be able to get that medical care that they need. It's well and good to rely on a charity system, but you certainly can't force a doctor's office or force a hospital to serve someone that can't pay. And coverage is access.